I did receive therapy. It was actually before I gave birth, but I was really late in the game. I was like 28 weeks pregnant, so I think I had like 1 or 2 sessions with the birth mom therapist before I gave birth, and then after, there was like several months of sessions afterwards, completely free, never paid a dime. And then I also had beforehand built relationships with some other birth moms that I had met over time, and they were also just there for me. It was different than like talking to someone, say a family member or a friend who like supports you through this, because the other birth moms and the therapist has been there personally, or they've worked with a lot of birth moms in the past. So I found it to be very invaluable, as kind of like a safety net, even though some days I just didn't want to go to a session, but I knew, like, I forced myself to go because there were things that came up during that time where I was like, okay, this is like a preventative for, in the future, my mental health being at risk because of this situation. So I would strongly recommend everyone, even if you think you don't need it like I did, like I truly did benefit from it, because there were things that came up in those sessions that I hadn't really thought of before, but at least I was able to deal with them and over time become, okay. And, it was just nice to feel like I had support and someone actually listened and could understand like what I was going through. So highly recommend, if you can. It is available to you. Just ask.